Okay, welcome to this product demonstration video where we're just going to run you through what is the best drug panel test for workplace drug screening. Now, when you're coming to choose or introduce drug screening in the workplace, the first problem you have is choosing the right combination or the right group of drugs that is going to give you a comprehensive screen. What you won't find anywhere is any legislation, rules, regulations or guidance in terms of the exact combination that you should be using in workplace screening. The reason for that is there is no set perfect combination. The more drugs you screen for, the more you are likely to detect, but that has to be balanced against both the cost of purchasing and running these tests and your ability and interest in certain rare and wonderful drug groups, many of which might not actually be that widely used or a problem in the area that your employees are coming from. So we usually guide businesses when they're trying to make this choice to look at starting with, when we're talking about urine screening, this is anything from a 7 up to a 10 panel combination. We feel that that level of drug combination covers all the common drugs of abuse and gives you the ability to add in a few extra things that might be of interest to you because you're aware that there is a local problem in the area. So as a baseline starting point, we would recommend looking at a 7-panel workplace drug screening combination. This is one that we've got here on the left. This is made by Alltest and sold by UK Drug Testing, and the combination that this screens for covers most of the common drugs of abuse that is of interest and significant in terms of its effect potentially on the workforce. So we've got OPI, screening for opiates, cannabis, THC, AMP for amphetamine or speed, MET for methamphetamine or crystal ice, MTD for methadone, and on the reverse we've got a screen for benzodiazepine, and on this particular combination 6-man, which is a specific opiate screen which will differentiate heroin from all other opiates. So it allows you to differentiate if you've got a positive on opiate and somebody's on a prescribed opiate painkiller, quite legitimately, whether that is giving you a positive opiate result or not. Now on the right we've got our combination 10 panel made by Instalert, and this gives you 10 individual drug groups. So in addition to the 7 there, we're screening for cocaine, amphetamine, methamphetamine, cannabis, methadone. We've got MDMA, ecstasy, MOP for opiates, BAR for barbiturates, BZO for benzos and TCAs. Now, some people may say, well, I don't need the TCA screen, I don't need the barbiturate screen, those are very rare, and the TCA, the tricyclic antidepressants, are very unlikely to be prescribed in depression for any of your employees. But there are still localized areas where these will pop up and cause problems. So you may want to just introduce a comprehensive 10-panel combo into your drug screening procedures so that you are going to pick any issues that occur up and be able to address those. So those are the 2 variant combinations. There are different combinations of 7-panel and different combinations of 10-panel and 7-panel available, which will give you different options depending on what advice you're getting, either that you're aware of in terms of a drug issue, or whether your local drugs team is flagging up certain things like PCP may occasionally come to the fore and you need to introduce a screen for that. These panel combinations will allow you some flexibility to swap and change between different combinations on a 7 or a 10 to be able to screen for those intermittently or as they occur. So we would recommend for employment screening looking at a 7-panel as a starting block and increasing that as necessary up to the 10-panel if you feel that's appropriate locally. But nobody will criticise you for doing a 7-panel drug screen as long as you're covering the 5 core drugs of abuse, the common ones. So you've got to cover on anything that you look at purchasing: cannabis, cocaine, opiates, amphetamine. And we would recommend introducing either one of the other 2, either benzos or methadone, just so that it's in line with what the police are doing roadside testing for in the UK, particularly if you're in that line of industry. Okay?